Mr. Young, you recognized.
Well, thank you, Mr. Chairman, for allowing me to be part of this subcommittee hearing. I don't typically sit on this subcommittee. I want to thank all our witnesses, including Mr. Womack, fellow Hoosier. I want to ask questions along the lines of the new 30-hour work week definition of full-time employment under the Affordable Care Act. You're all familiar with the fact that the ACA redefines a full-time work week from the traditionally understood standard of 40 hours down to 30 hours. And I have heard, as have all my colleagues, from employers, restaurants, school corporations and others about the adverse impact of this, not just on operations of an enterprise, but on the workers themselves. 39 school districts in the state of Indiana have actually sued the federal government on account of this provision. Industries that employ low-skilled workers are particularly adversely impacted. 89% of workers impacted don't have a college degree. Just to give some sense of the hourly impact on wages, an employee going from 35 hours down to 29 hours is effectively receiving a 17% pay cut, courtesy of this healthcare law. An employee going from 39 hours down to 29 hours is losing an entire works week worth of wages. So, Mr. Womack, as a restaurant owner, as someone who's owned businesses for a number of years, could you share with us the real-world impact of this new 30-hour standard on your business, and perhaps speak to those who indicate that the 30-hour threshold is having no impact on business?
Well, as I just indicated, I have seen numerous other people in the industry, seek to meet that threshold. It's interesting. My industry in particular, we have a lot of flexibility and we can adjust to a lot of things, and we've done that. But as you indicated, there's numerous organizations out there. School systems is a great example. Universities and so on, where they don't, they have fixed budgets coming from their states, and they don't have any flexibility. And so, looking at this cost, they've had to make that cut. And we haven't done that. I have a bigger concern that, that by offering coverage, to our pool of employees, we've gotten numerous comments from our staff saying, hey, the fact that you have offered me coverage now makes me ineligible for exchange plans, ineligible for subsidies for my dependents, and so on. That's a big gap there. And, there are just a lot of people at the lower end of the income scale who cannot play in this healthcare economy, even if they had the healthcare coverage.
So there's a related burden on employers that we've heard much about as well, and that's the reporting requirements associated with the ACA. And perhaps, Mr. Womack, you could indicate any resources you've had to invest in on account of the reporting requirements, and maybe even tell us how much time and money have been involved in these investments.
Well, a tremendous amount of time. We've spent the last several years looking at how we were going to report. And when the requirement first came out, we kind of thought, okay, we think we can do that. And then what we found was the data was not readily available. We do our own payroll. We do our own accounting. We have our own bookkeepers in-house. And what we realized was the data wasn't sitting there in our system. We had to create it. And it was, because of the requirement, the way it was written, it's literally something that has to be done on a monthly basis, even though we're not doing that.
So I come from a small business family, and I know there's a limited pot of resources, and if they're diverted to do one thing as opposed to another that has real world consequences, where might have you otherwise spent these resources invested in compliance?
Well, absolutely into additional payroll, into more people.
More people,
yeah,
higher wages,
we're in a business
perhaps,
where the more people we can put into our restaurants, the better we can perform. So we're constantly having to choose between the service and that we give and other things in our budget.
Thank you. I yield back.